Good morning. My name is Dr. Melody Medley Keith. I'm here at Lakeway Aquatic Physical Therapy, and we are doing a snapinar today on one of our devices that we have. It's called the Hivamat. Okay, and what it is, it's a lot of name, a big long name, but what it does is it's deep oscillation with electric current. So it takes a cross current and puts it through the body, and then also adds deep oscillating current, a deep oscillating massaged into it. And what makes it so wonderful is that it is very gentle. We find clinically that it is much better than anything you would use as far as the heat stuff, lasers, anything like that. So we use it for pain, for inflammation, for just joint stiffness, anything like that you have. And I'm just kind of doing it on my knee. I know you can't really see it, but this actually oscillates very, very deep. We love it. It goes as deep as when we do an ultrasound. So again, the Hivamat is a modality, but I thought it was very, very unique. The reason why that I love this machine is because it doesn't press down on the joint. It actually lifts it up to help with inflammation and pain. And if you see, I'm kind of completing the circuit by holding this. And so it's going to help with lifting the tissue up and trying to move all that excess fluid in there, as the knee, the hip, the foot, the ankle, the shoulder, whatever you have. That's what's so nice. The other really nice thing about the Hivamat is that I can do a very large area, like I could do the whole lower leg. Where in an ultrasound, we can only do just a very small area because the ultrasonic waves only go so much and you only want to do just a small amount. Where this, we can go just as deep as an ultrasound. For those of you that have had ultrasound before, just as deep as any infrared or any heat therapy that you've had. But what this does is goes deep and it lifts. I always think of it like lifting and separating, because you understand when you get inflammation between the fluid between the muscles and the tendons and all that, they stop gliding. So what we don't want to do is kind of push down on them and put more stress and strain into the joint. We want to try to lift them up and try to get them moving. And that's exactly what the Hivamat does for us. So for those of you that have maybe some nagging pain, nagging swelling, that you've tried ice, again, I always recommend you do ice first, right? But if the ice isn't working and you've tried other things before, come in, try a little bit of Hivamat. We'd love to introduce you to the product, introduce you to what it does, and the best thing really is that it's very gentle. There's no pain. You're not sitting there going, oh, like that. It's just really goes over. You can see how it's kind of oscillating my knee, but it's very gentle to try and help the tissue. Hivamat. It's wonderful. We love it here. Clinically, we've had a lot of success. A lot of my patients really love it on their back and in their hips, in areas that tend to be a little less mobile and a little more prone to pain and decreased range of motion. If you guys have any questions, please feel free to call us. You can always put them in the comments section, right? And we'll get back with you on that. Or you can always call us here at the office. We do take most major insurances. We are outside of Austin in Lakeway. So for those of you that are in the area, we'd love to see you come on by. If you have any other suggestions or anything, we'd love to hear them. Just, again, if you can give us a little thumbs up, that's great. And if you can hit the bell, that will notify you when we do another Snapinar, because we do these twice a week, Snapinars, just to try to get you information about how you can stay healthy. So we really appreciate your time. Talk to you later. Bye-bye.